Hi, how are you? If you're new here, this is Tenzin, one of the resis from Canberra, Australia. So I'll be answering some of your frequently asked questions in regards to AMC in one of my Instagram posts 2 days back. So let's get started. All right. The first question is, Bhaiya, after just graduating and clearing AMC 1, how many chances to get job offer as a fresher? Now, this is one of the frequently asked questions that I keep getting in my DMs. So, job after AMC 1 depends on many factors. Some of the factors that I can enumerate are the first one being your luck, second one, your CV, your cover letter, and your interview preparation skill. Third one being your clinical experience years. The more the number of years, the better the chances. The fourth one being how desperate or how in need the hospital is to employ someone with just an AMC 1. Now, sometimes some IMGs get it and some don't. Now, in my case, I was not able to secure a job with AMC 1 and in English exam with 4 years of clinical experience. So I decided to take the AMC 2 exam and then reapply for all the jobs. Yeah, that's pretty much it. And the general trajectory for the IMGs is IMGs generally prepare for AMC 1 first, then take the English exam, then start applying for different jobs. If not successful, start preparing for AMC 2 and then apply for the jobs again. That's it. All good. Let's move to the second question. How does the opportunities look like in Australia now and possibly next year, saturation wise? All right, I'm not the best person to tell you the saturation wise in terms of job opportunities for the doctors in the coming years. However, as a resident, what I've observed is that in most of the hospitals there's severe shortage of doctors, so that's why, in order to fill the gaps, the hospitals generally employ locums, who are the part time doctors who work for 1 month to few more months, and they get paid 2 to 3 times more than the usual full time resident, like someone like me. So I think that there's very good opportunities as of now and probably next year, and probably years after that. If you have the right qualification and the right skill to enter into the Australian healthcare system, there's a very high chance that you can be employed. All right. The next question is, how can I improve my CV? Now, when someone asks this question, everyone expects, okay, research papers, publications, poster presentation. All right. All of those are important, but the most important thing is the clinical experience. Now, your competency as a clinician is so important that in your CV, you can mention the procedures or the skills that you can do, what responsibilities and what role that you have played in the clinical healthcare system in your home country. And if you ever get an opportunity to do an ED rotation, please do that, because emergency medicine skills are very important and are highly desirable for someone to get the first job in Australia. And yes, it's also very important to do few courses. Just make sure that you portray as someone who is a keen learner and who always does some kind of course over the number of years. And the important ones are the emergency courses like basic life support and advanced cardiac life support, even pediatric life support, and make sure that those are American Heart Association certified. Even though the certifications are valid for 2 to 3 years, it just doesn't matter. You can do those again in Australia. Just make sure that you portray as someone who has a good emergency skill, who has a good clinical experience as a doctor, even though you don't have a huge number of years of experience, but even though you just have 1 or 2 years of experience, but if you have done a lot, if you have seen a lot, whether you have observed it or preferably whether you have done it under supervision, those are the desirable skills that you can put in CV. And so please make sure that you attend the clinical rotations in different departments and you get all the skills, the clinical judgment, and not just sit in the room and study. That's not a desirable doctor at all. How long does it take for getting into surgical residency in Australia? And is it possible for Indian IMGs to do so? Now, I'm not a surgical resident, so I may not be the best person to give you all the ideas about surgical residency. But what I've observed is you do see IMGs working as surgeons, but it's not too common. Um, as expected, surgical branches are definitely more challenging to get in Australia than the medical branches. Now, what I've observed is even the local graduates do a few numbers of years as a PHO, which is the principal house officer, which is above the RMO or the resident medical officer. Now, the PHOs are not under any training program yet, but they do few numbers of rotations in the surgical departments. They get good clinical experience and they get good referees, and then they take the exams and enter into a training program. Then they become a registrar. So, yes, it could be a bit more challenging to secure, but definitely not impossible. All good. The next question is, how should I prepare my for my work experience certificate? If you can throw light on its requirements. So that's very important. So when you apply for registration under AFRA after you secure a job offer from a hospital, so it's very important that when you are working in the home country, make sure you have either a state registration to show that you are currently working in that particular state, or you have a central registration. So, because I've noticed that some of the doctors who practice in the state, different states have their own registration requirements. We call it as a registration certificate in India. Some doctors have a central registration certificate, which is very good. So if you were like someone, because I've moved three states within India when I was working, so I made sure that I had my state registration certificate in each state that I moved. Now, even though the dates are a bit not up to the time when you started the job, that's okay. But make sure you have a state registration certificate. Another proof that you can do is whenever you work, you take uh, a letter from the head, whether it's the admin staff or a medical staff, um, just to prove that you did joining on that particular date and you worked up to that particular date. Now that shows your work experience, and both of these certificates should be good. The next question is, there's this talk about waitlisting when it comes to slot booking for AMC clinical, how difficult it is. Um, yes, booking for the examination, whether it's AMC1 or AMC2, AMC2 in particular, is quite challenging. Um, it's first come, first serve basis. So I'm not sure if they have changed and there is a slot booking system now. Because when I took the exam, uh, it was a first come, first serve basis. You just have to keep an eye on the time that it clicks and um, the slots open, and then you immediately try to log in, do the payment, and yeah. So if you are not successful to secure a slot for the exams, it'll be very good if you send an email to the AMC stating that you prefer to take the exam on that particular date, and if there is uh, any vacancy for the exams. Now sometimes the candidates can withdraw from the examination due to any personal reasons, and in that way the AMC can give you that slot instead if you're lucky. So yeah, all good. Did you publish any papers or research in that time? Also, what about the recency of graduation? All right. When I was applying for my jobs after AMC2, I didn't do any research, or I didn't have any sort of publications. Now, what really mattered was the AMC2. So I always say AMC2 is the game changer. If you have AMC2, you have all the high chances. Now, recency of practice. It's very important that when you are doing the paperwork for AFRA registration, and even the hospitals when they want to employ you, AFRA generally prefers someone who is practicing currently as a doctor, whether it's a hospital or in the clinic. That's called recency of practice, and the minimal requirement is the doctor should be practicing at least 3 months prior to applying for the job. So, what I would always suggest is never to leave your job while you're preparing for AMC exams, because you can always show the recency of practice first of all, and the second is you can always show the number of clinical years of experience that you have worked. So it's very important to keep working. Now, even if you had 1 or 1.5 years of gap before, um, that does not really matter, as long as you have the recency of practice, which is like you are working at the time of applying for job. Okay, all good. The next question is, how much time did it take for you to get a job? I'm assuming RMO after passing AMC2. Yes, 4 months. It was pretty quick. Next question. When should one join the online courses like First Aid AMC? Is it better to do the Amidex first? Now, if I was in your shoes, I would join any courses as soon as possible if I'm 100% sure that um, I'm going to take the AMC pathway. Because the advantages with any course is it'll give you all the study materials and all the guidelines. Like, you just have to study it rather than you searching everything from scratch and taking all the time. If you have a lot of time, then you should do it by yourself. If you want to do things fast, then definitely take any course. So First Aid AMC is one of the courses that I've taken for AMC2, and I found it pretty okay to pass the exam. Now, whether you should do Amidex first or not, I would say you can take the Amidex later on after doing any course, because Amidex itself is a huge question bank that'll take a lot of time. Now, just see if you have done all the course materials, then it'll be worth to do the Amidex questions. Can you name the order of positions that we can apply and the duration, like GMO after RMO? So when you're applying for jobs, um, if you are a fresher, definitely apply for RMO or GMO, which are the junior most positions. Preferably apply for those which says for those candidates who are eligible for registration rather than those who already have general registration, because you would be eligible for limited or provisional registration depending on whether you have done AMC1 or AMC2. Uh, Now, if you have a good number of clinical experience, you can also apply for SRMO, which is the Senior Resident Medical Officer. And if you have already done a post graduation in a particular branch, let's say pediatrics, and you can apply for pediatrics SRMO. There are also rotational SRMO as well. If you have like 3 or more than 3 years of experience, should be good. Um, but definitely don't apply for registrar job. It's very tough to get unless you have a very good years of clinical experience working in one particular branch in your home country. The next question is, sir, in your first year MBBS, did you study standard books or not? I mean, are those standard books a must? uh, so there's a lot of a debate about whether you should read the standard books or just the books for the examination. Definitely, you should read the standard books when you have time. Um, that means when you really want to learn the concepts. Um, the books that are meant just for passing the exam definitely do not add much value in terms of understanding the concepts. But if you're running out of time, definitely look for those books because the priority is to pass. Um, it's not a must. Definitely, I can say that it's not a must to read all the standard books and then you'll be the best doctor ever. No. Um, Read the standard books for certain concepts, do your clinical rotation, read the exam oriented books for the exam purposes when you're nearing exam, but definitely see your own capability. Don't just do what others are doing because people have different capabilities in terms of grasping uh, the theory as well as in terms of doing clinical skills. So it really depends on uh, your choices, and make sure that you're not stressed juggling between the standard book versus the non-standard book. Just don't worry, like go with the flow and do your best. All right, that's the end of the questions. Obviously I can't answer all of the questions because the video will be so long. Definitely I've answered the relevant ones which I thought that by making a video this will create, or this may add some values hopefully. Thank you so much for all your support, and cheers, we'll see you in the next video. Bye.